Hello, I'm Matthew Koffenberg, physical therapist and owner of Back in Motion Physical Therapy in Perham, Minnesota. Today we're going to talk about knee pain. We're going to talk about one specific type of knee pain. This particular type of knee pain is pain in the front part of the knee, and it affects mostly young women. However, it can affect men and it can affect anyone at any age. However, it typically will affect 18, 19, 20, 21-year-old women. This particular condition of knee pain can come on with a lot of activity, like a lot of jumping type activities, or surprisingly, it can come on with a lot of inactivity, specifically if you sit for a really long time. So a lot of people will come to me and one of the first things they'll say is, man, my knee starts to hurt right in the front of my knee when I go to a movie. So you're sitting in a movie for 2 hours and that knee just starts to throb and ache. That's a very common characteristic of this particular type of knee pain. This knee pain is called Chondro Malacia. So let's look at that term. So chondro means cartilage and malacia means softening. So the term Chondro Malacia means softening of cartilage. So specifically, we're talking about softening of cartilage underneath the kneecap. Our kneecap is called the patella, and there is a thin piece of cartilage directly underneath that kneecap. So if you look at the knee anatomically, the knee is made up of the two bones, the large thigh bone called the femur, and then the shin bone as it comes up. That is our knee joint, and then on top of that we have a circular bone. It's a small bone called our kneecap. Underneath that kneecap we have cartilage. So if you took this person that we're looking at right now is just standing straight up, if you took that person and had them lie down and you looked through their knee right through their feet, you would get an angle like we have over here. So if we're looking at this angle, this bone here is our femur. That femur is made up of these humps called condyles. And the kneecap, which is this structure, the kneecap actually sits right in the middle of those condyles, right in that groove. The blue portion of my drawing here represents the cartilage. So this is perfect positioning of the kneecap. When we have Chondro Malacia, we have what's called poor patellar tracking. So what happens is that kneecap actually tracks off to the side. And you can see when we do that, if that kneecap tracks off to the side, that blue cartilage is going to get squished in between those bones. And when it gets squished, it gets soft and you end up with pain. So what causes that kneecap to actually shift over to the side? There are really about three things that cause it. One of them we can't do anything about. The others we can do quite a bit about in therapy. So the big one that happens affects the muscles. Okay, so what will often happen is our quadricep muscle, which is our big thigh muscle, what will happen is our quadricep muscle will actually get weak. Especially, the quadricep is actually divided into about 3 different parts, and especially this inner portion of the quadricep will get weak. And then on top of that, what will happen is this large band of tissue that's on the outside of the knee. It's called the IT band. That IT band tends to get really, really short, or it gets really, really tight. So when that IT band gets tight, it'll start to pull the patella or the kneecap that direction. It gets really tight. In combination with weakness, the quadricep can't stop the IT band from pulling it. So the kneecap in essence just starts to shift off to the side and you end up with this poor patellar tracking. So treatment for that is getting that IT band a little lengthened, but more importantly, really strengthening your quadriceps. The other 2 components that lead to poor tracking, again I mentioned one you can't do anything about, and the reason why it affects women more, women have what we call wider pelvises, and a wide pelvis, when someone has a wide pelvis, what will happen is it'll automatically cause that femur bone to actually drive inward. When the femur bone drives inward, the kneecap actually basically kind of squirts outward and you end up with poor tracking. The third thing that'll happen that we can do some things about is you can end up with what's called a tipped pelvis. If you look at some of my other videos, we talk about the pelvis tipping a lot, and that's usually due to weakness in the stomach and weakness in the butt. So whenever we walk, that pelvis will actually start to shift. So it'll shift upward, and when that pelvis shifts, it drives that thigh bone inward again, and then the kneecap tracks outward. So a lot of this is a lot of strength training and a lot of just developing home exercises. The other things that we can do in therapy is we can tape that kneecap. So a lot of times we'll tape that kneecap, we'll take that kneecap with some tape and pull it back into the middle, and then do some strength training when the kneecap is in the middle. And just really helping your muscles learn how to keep that kneecap in the middle. Very common condition, but very easily treatable. Please give me a call if you have any questions, 218-346-2464.
Thank you for watching Wellness for Life.